สวัสดีค่ะ I'm vanvarin veerasarn and my student ID is 6129025 and this is the pons assignment. For the first question, I say that the first symptom the patient has decelerate because he has unconsciousness, arched back head, all four limbs are extended, and it has damage to rubospinal tract, brain nucleus, cortical spinal tract, and the lateral reticulospinal tract is also involved. This shows that there has lesion below the red nucleus, so the rubospinal action is not involved, but instead the unopposed lateral reticulospinal tract action is involved. And this lesion below the red nucleus means that the rubospinal tract is inhibited, so the upper limb will extend. And lesion of cortical spinal tract means legs extension. For the second case, the second symptom, the patient has decorticate because the patient has flexed position, bent inwards, arms, and clenched hands into fists, and the legs is also internally rotated. And this means that the patient has rubospinal tract damage and red nucleus and cortical spinal tract is involved. And the lesion is above the red nucleus because the rubospinal tract starts at the red nucleus, and in this case it will still work and it facilitates the upper limb flexion. So since the lesion is above the red nucleus, it will remove the inhibition of the rubospinal tract and it will overcome the upper limb extensor, and the lesion of the cortical spinal tract would cause the leg extension. So when in comparison, the second symptom, the corticate, is less severe because the damage is not involved with the reticulospinal tract, which is one of the most important extrapyramidal tracts, and it controls the activity of the lower motor neurons and it influences the neuron through the internonical neurons, which is inhibitory neurons. And for this question, I answered A because it's not B and C because it shows better signs, but B and C said that it is not progressing in a good way, and it is not D because it is possible to occur. Since we can say that person A is in recovery period, A is correct. And second question, so the bilateral medial tegmental pontine damage is at the dorsal pontine area and contains the apneustic and pneumotatic center, which controls the respiratory rate. In the apneustic center, it sends signals for inspirations to be long and deep breaths, and it's located in the lower pons, stimulates the inspiratory neurons for the DRG and the VRG, which is the dorsal and ventral respiratory groups in the medulla, and the damage will cause the apneustic breathing, which means the patient will stop breathing, and it will make lower oxygen, higher carbon dioxide level, and it will increase the blood pH because it's acidic. And in pneumotatic center, it sends inhibitory signals to the inspiratory center of the medulla, so it controls the inspiratory time, which means that it has the subparabrachial nucleus and the parabrachial nucleus located in the upper pons area, and it limits the activity of the phrenic nerve and the inhibition of the signal of apneustic center. So this will make the prolonged inspiration time if the signal is weak. It causes breaths to be deeper and increase venous returns and decrease cardiac output. So if the damage of the apneustic center make the low oxygen, high carbon dioxide, and low blood pH, and the pneumotatic center will promote for deeper breaths and increase the tidal volume. But however, the lesion area is actually not clearly indicated if it's medial or lateral area, despite it's in the area of the dorsal pons. So we cannot actually answer the question since since we are not sure about the lesion area. So E is the most correct answer because it's dependent on the lesion. For a third question, the loss of pain and temperature is from the spinal thalamic tract damage, and it is synapse and across the spinal cord. And the loss of vibration in the left is caused from the damage of medial lemniscus in the right area, and its synapse and cause at caudal medulla, and the right hemitaxia and intention tremors is from the damage of the right pontine tegmentum. And this is because it contains the pontine tegmentum contains the nuclei of cranial nerves and also the motor processes, and which both of the damage has to be included in the movement coordination, which is involved in the pontine tegmentum and the medial longitudinal fasciculus is ipsilateral, in which the tracts is located on the same side. So for this question, there is damage on the right medial lemniscus and the right pontine tegmentum, which means that for in case A and C, both of it shows that, like for A, it shows damage of facial nucleus of the right. For C, it shows that there is trigeminal nerve and the mandibular branch damage on the right side. And since the patient has damage on the right side of medial lemniscus and pontine tegmentum, so it means that A and C is not possible because there is damage on the right side. And B is most correct because the answer is the thalamic lesion promotes this contralateral loss, which means that the left side lesion would be present, the thalamic lesion in the left side. It's possible because the right the patient has right side damage on the medial lemniscus and pontine tegmentum. So in this case, B is the most correct. And for question 4, the lancinating facial pain caused by the pain in trigeminal nerve distribution on the left. And in the question, it shows that the patient has incomplete Horner syndrome. It's damage to the sympathetic nervous system because the patient has ptosis, meiosis, and not anhidrosis, which means that the lesion, it affects the sympathetic fibers in the internal carotid plexus but not the external carotid plexus because the external innervates this facial sweat glands. So if they don't have anhidrosis, it will not include external carotid plexus. And the corneal reflex is included in the trigeminal reflex sensory nuclei of CN5 and CN7, the facial nucleus. And the allodynia is resolved from changes in peripheral nervous system or the spinal cord and brainstem. The diplopia means that this injury to the CNV1 on the CN3 and CN4 is also possible, but it's not as common. And the conjunctival hyperemia shows that there's dilation in the conjunctival vessel around the eye, and hearing loss is due to lateral lemniscus lesion. So for this question, it could be summarized that there is damage in many parts, like the trigeminal nerve, sympathetic nervous system, and lateral lemniscus. So for choice in A, B, C, it's incorrect because it's very specific region area, like the Russell area of the brain or the caudal area of the brain, and it does not include all the damage that is identified. So the lesion is possible since it may occur in the peripheral nervous system that includes major part of sympathetic nervous system, and it also includes the cranial nerve and spinal nerve and roots.